Hello everyone, so sorry I have to make this video again because I forgot to cover up phone numbers and stuff, and I was like, shit, and I really couldn't go over all the details with you. So we are going to look at my pre-op, what's in my binder. So I'm not sure if I made a video about this or not. I think I have. I'm not sure what all I talked about. So we're just going to go through the whole pre-op thing from the beginning. So this might be a long video, and I'm sorry. What's the matter, girl? I'm pet sitting right now, but I really wanted to make a video while I could. But yeah, she's adorable, and she's huge. Anyways, so for me, I had to get on their website. Let me just mute my phone for a second. Kick Messenger is going crazy. Anyways, what I did was let me make this full screen. Okay, so I wonder if I should take my glasses off. Probably, so you don't see, even though I look like absolute crap. My hair is a mess, and I have no makeup on, but you know what? Who freaking cares at this point right now? Oh, my hair's a mess, but I'm just tired of seeing like a glare coming from my glasses, so that's annoying. So anyways, back to our topic. So what I did was I went online, and it's like you take like a little, what's called a seminar quiz, and like they tell you about different things, and then you take like a few questions that were super, super easy. I even took notes to make sure that I passed the seminar quiz, and I passed with 100%. And that's when they called and scheduled me for what's called a 2-hour class. So I went there, and it was really cool because one of the girls, because I when I went to the hospital in 2015 for my suicidal attempt, which I don't think I've talked about, but I'll talk about that in another video. I became best friends with my roommate, and I haven't seen her since then. And then in October of 2016, I see her, and I'm like, long time no see. We're both wanting to get gastric bypass, so that's really awesome. But anyways, it's a 2-hour class. They talk about all kinds of different things, and they give you this folder that has all the information that you need. And the first thing I want to I'm not going to go over every little detail that's in here, but I am going to show you guys this. This is the surgical options that you can make. Now, which one is this? The lap band, which is pretty much what it looks like. They just wrap a band around the upper part of your stomach so that it takes longer for the food to go down, so you get full quicker. But they haven't had much success, so they actually discontinued this month, actually. So it's either the sleeve or the gastric bypass, and as you can see, the sleeve, they cut like your stomach in half, and they've removed this part. So your stomach's in the shape of a banana. So again, smaller stomach, you're not going to eat that much. And then gastric bypass, which is what I'm getting, is where they cut, like a pouch on the upper part of your stomach. They leave the stomach in though, so it is reversible eventually. And then they bypass your intestines. So you get your body will take less calories than what you've eaten, so which is really nice. But yeah, I've seen so many success stories, and even one of my coworkers, I hate when it does that, when it gets all blurry. Whatever. Oh, there we go, finally. So yeah, that's pretty much it on that. They just pretty much went over everything that's in the binder and stuff, so no biggie. However, and then after that, you get this, it's called bariatric pre-op checklist, and depending on what your insurance requires, they highlight all the tests that you need to get done, including either, for me, it was either a 3-month diet or a 6-month diet. Obviously mine was a 6-month diet. So I'm going to try to this time cover this. Let's see, how am I going to do this? Yeah, that works. Okay. So, for me, I needed to get an upper GI done, which most of these tests, in fact, all of these tests I need to get done, I was able to finish within October because my mom had a week's off vacation. So we were like, let's just get all this done now. So that's why you'll see a lot of this is in October, like the upper GI, which I think is when you call radiology at the hospital and you go there and you drink like this liquid and they take pictures and stuff, make sure you don't have like that acid reflux disease or something like that. Luckily, I don't. I mean, I have a little bit of acid reflux, but it's not like super bad. And it'll completely go away after surgery, so that's a plus. So yeah, so for me, it was, I drank this super fucking thick liquid, and you have to try not to burp, which is really hard. But you have to try really hard not to burp. So it was easy, and it actually didn't taste as bad as I thought. Like, it tastes nasty, but it wasn't that bad. It just, it wasn't the best, but it didn't taste like super horrible. But the hardest part was moving positions on the table. Because obviously, since I'm big, it's a lot harder for me to physically move around, let alone when you're in a laying position. So yeah. And then the nutrition quiz, as you can see, I pass. And that's just you talking to your dietitian. And there was a paper, but obviously I don't have it anymore. I might have a copy of it somewhere in this folder, which I don't feel like looking right now. It's okay, girl. And I pretty much passed with 100%, so yeah. And then for me, I had a psychological evaluation, which I got that done. I'm actually still seeing her, so yeah. And then, of course, mine says a 6-month diet plus a 5-year weight history. Now, letter of med necessity is just, there's like little papers that the doctors fill out every month from your weigh-in that they give. So, my last weigh-in is next month, February 1st. So that's when that will happen. Plus they write like a letter, which I'll show you in a second. And then my sleep evaluation study I got done. And I did an at-home study, which I will explain that in a second. And then all this other stuff I didn't need to get done, like cardiac or anything. And then TSH is for your thyroid, which, as you saw, I got that done in August because that was when because I used to have problems with my thyroid. But apparently not. And then it obviously just says quit smoking 1 month before surgery. And I don't smoke, so I am good to go. But for people who do smoke, they want you to stop smoking a month before surgery. So, yeah, there's that. But yeah, so, ow, my hair. So yeah, that's pretty much it. And then this is new. But yeah, this explains about the letter of medical necessity, and that's just guidelines for the doctor to write, like non-surgical attempts to lose weight, such as Weight Watchers, Jenny Craig, stuff like that. For me, I would use Team Beachbody, because that's considered a non-surgical attempt. Comorbidities, I suck at pronunciation. All serious weight-related health problems, so the risk of developing those conditions, blah, 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 blah. And the medical clearance, and that's just saying that I'm medically clear for bariatric surgery. So, as long as, like, my organs, which is, so from the blood work I did. And any additional information that will help ensure the best possible outcome for me. And then office visits, yeah, that's pretty much it for that. So that's that. These are just free seminars, so you can go to like support groups and stuff. But since I don't have a car and where I'm going to is kind of far, I haven't really been able to do that. So yeah. Now this is the Obesity Progress note. And again, I have to cover my shit, I think. Well, actually, no, maybe not. Okay, it only has my name, and you guys know my name, so fuck that. Okay, so this is what my Obesity Progress note looks like. So, it takes your vitals, which lets you know what the weight is. what my BP is, my pulse, my BMI, and the date, and how much I lost, which is, I lost that pound that month. So, yeah. Past diet attempts, yes. What else? And my doctor has me on a 1,200 calorie diet. And then this is all the stuff that they check mark, which low-fat dairy products, which I have been, because this is an old thing, so this is before I got started, but now I drink like fat-free skim milk. Lean protein, reducing sugar intake, vegetables and fruit, eliminating soft drinks, decreasing consumption of empty calories such as junk food, and eating out less often. And then it has exercise/activity right below, and that has walking, biking, swimming, curves, limited mobility, housework, yard work, lifting weights, water aerobics, exercise, and then other. So for me, it'd be like my workout DVDs that I do, as well as walking, lifting weights, and some housework. And then summertime I'll have swimming, but obviously I won't need this because hopefully I'll have surgery before then, way before then. And then the exercise frequency just has like 15, 30, then how many times per week. And like limited due to like shortness of breath, cardiac, that kind of thing. Diagnosis, of course, I'm considered super morbid obesity because my BMI is over 50. And then related comorbidities. So for me, I have severe obstructive sleep apnea, so I do have a CPAP machine. As well as depression, everything else I don't really have. And then just continue 1,200 calories per day, and that kind of stuff. So that's just what that looks like. So, yeah. So, yeah, I took a at-home sleep study, which is, I'm going to go back to that folder I showed you, that paper I showed you guys, kind of go into detail about my testing really quick, since that's most what people be nervous about. Alright, so I explained about upper GI, explained about nutrition, psychological, and that's just, and there's like a paper too, that you give to the psychologists, and it's just kind of like guidelines of what they should ask you, of how you feel and how you would benefit, and if you're really serious about it, because obviously if you're not this serious, you're not, because the surgery is a great tool to help you, but it's not a cure-all. You still have to do the work. So they just want to make sure you're mentally prepared for that. And then the sleep evaluation was super easy. I got it from I got it from the sleep study at the hospital, and it was just like this machine thing you put, and it's like a blue box and has like a headband around it, and it has like an oxygen that goes under your nose, and it just reads you while you're sleeping. And then I returned it the next day, and because I knew I had severe obstructive sleep apnea, but since the home studies aren't that accurate, I ended up taking another sleep study at the hospital, which was very uncomfortable. But I had a choice of what kind of mask I wanted, and since I'm a mouth breather at night, I had one that covers up your nose and your mouth, so it like goes around like that. So, and since then, I got my own CPAP machine and mask, which, for here, I just said I'll make a video about it. I mean, even that has nothing really to do with weight loss, but I mean, you know, let me know, I guess. But yeah, so that's just that. And yeah, that's pretty much it, actually. I'll be darned. So, yeah, that's pretty much it on that. I'm just trying to go through some of this stuff quickly. And they have like names of who to contact, like for the nurse, insurance specialist. But yeah, the 5-year weight history is probably the toughest part, because I didn't always have health insurance, so I didn't always see doctors for many years, except for maybe when I was a teenager, and that was like 6 years ago. So that it's been hard, but I did get a medical card a few years ago when I lived in West Virginia, and I was seeing doctors, and I got weighed, and then I was seeing like this Good Samaritan clinic, which is like a free little health clinic, so that helped too. Oh, actually, I think I found that nutrition quiz I mentioned. I'll show you guys what it looks like. It's okay. She made a copy for me, so yeah, I just circled them and she just reviews them. And it just tells you different things, and it's pretty much you pretty much learn all this while you're in the 2-hour class, but it's also all in your notebook here, that in my folder. So it's, I mean, if you guys would like me to go over this in detail, I can, but I don't know if I really should or not. I guess I could just read these to you. It's only 50 questions, so. And this is for the gastric and sleep, by the way. I'm just going to tell you the answer. I'm not going to read like what the other options were. But which of the following foods are considered to be highest in protein? Milk, eggs, chicken, and shrimp. For life after gastric bypass/sleeve surgery, do the following. Emphasize protein. Take vitamins for life, and they have to be chewable. And drink adequate fluid. After surgery, drinking and eating at the same time will result in filling the stomach, leaving less space for food, and quicker food emptying. So after my surgery, whenever I'm able to eat solid foods again, I can't drink anything, I think like a half hour before I eat. I can't drink anything while I'm eating, because what happens is that since my stomach's going to be so small, I need to get that protein in. So no matter what meal I have, even if I, get full real quick, they always want you to eat protein first. So, yeah. Sugar and fat after surgery must be very limited in the diet to prevent dumping and weight gain, which, I'll explain that in a second. Regarding vitamins after gastric bypass or sleeve, take bariatric formulated, chewable, or dissolvable vitamins. In other words, after gastric, I'll never be able to swallow pills again, which is not a really big loss for me. I always hated taking pills. Supplemental vitamins or minerals to be included daily after surgery are adult complete multivitamins, iron, B12, and calcium citrate. After surgery, iron should be taken 2 hours separate from anything containing calcium. Not eating properly daily can result in malnutrition. Adequate amounts of protein after surgery on phase 4, there's different phases, include, for me it was A and B, which is 80 grams for males and 60 to 70 grams for females. But yeah, you go through different phases after surgery. Like, you go through like a short little liquid diet right before surgery, and that's like, it like helps the surgeon to move the organs around and stuff. And then phase 1 is where you go through a complete liquid diet for like 2 weeks, maybe, something like that. And then after that is phase 2, and that's where you can have like mushy pureed foods. And then phase 3, I think, is when you can have soft foods, and then phase 4 is when you can have solids. So that'll be a good bit, and it's like 2 weeks each phase, I believe. But yeah. What should be the first food item consumed at every meal? Protein. Beverages for life after surgery should be non-carbonated, non-caloric, and non-caffeinated or limited caffeine. What's the matter, girl? What's the matter? In addition to diet, what is beneficial to success after surgery? For me, it was all of the above, and that's sleeping well for at least 7 hours per night, exercise on a regular basis 4 times per week, and attend a support group meeting. The ideal choice of a protein supplement would include which of the following? Whey protein isolate. During which phase do you begin taking vitamins after surgery? Phase 2 with the pureed foods. At your first op visit with the doctor, of course. And then dumping syndrome is a condition that can happen by eating too much food at one meal, eating foods that are high in sugar, and eating foods that are fried or high in fat. And by dumping syndrome, I mean it's where you feel really sick and diarrhea and constipation. It's just not happy fun times at all. So, yeah, there's oh, by the way, it has like all this stuff, like diet, nutrition, pre-op, post-op support, and miscellaneous. So I just thought I would show you that real quick, I guess. But yeah, here's the different phases. Explains what they are and when they would happen. Just giving you an example of how long and stuff. So, like, phase 1 lasts for 7 days from discharge day. So I can say that I think 2 to 3 days in the hospital right after surgery before I can go home. Phase 2 lasts for 2 weeks. Phase 3 is 3 weeks, and then phase 4 begins at 6 weeks, and then yeah. What else? And then they just give you like nutrition guidelines for the surgery. Like to sip, like you can't really chug on water. Eat 3 to 4 small meals a day. And then it gives you like groceries, like what kind of stuff you can buy. And what you can get. Like, for instance, since I love sugar, but I need to get rid of that. You can use artificial sweeteners such as Splenda equals sweet and low, Trivia, and Stevia. And so far, I like Splenda, and I have like a whole box of that. So yeah. And then it talks about your different phases, such as liquids and what kind of stuff you can get. Phase 1's gonna suck. It's gonna suck. And then it talks about phase 2, and then it gives you like examples of what kind of meals you can make and eat, so that way if you really don't know, you could just go by the guidelines that they give you, so that makes it really nice. And then they talk about your supplements and all that jazz. Yeah, all this I'm gonna have to like read over again and like study more, so that way I know. But yeah, that's pretty much it on that. It just tells you all kinds of different things, and yeah, about food and stuff, and things that can occur, things that can happen, and making sure you're aware, blah blah blah. So yeah, oh, here's my empty Obesity Progress. No, I don't know why I had 2 when I only needed 1 more. Whatever. So yeah. And then they give you, which I'll go ahead and show you really quick. Obviously, I didn't get this done because I had already gotten my TSH done in August, so that was good. Yeah, they give you like little like papers like these, depending on what you need. So you pretty much have all that, so you just make an appointment to give that to whoever you're seeing and that kind of thing. So that's no biggie. They pretty much have you covered. So it's really good. And also, this is all just my personal experience. So don't just go by what my surgeon, what my doctor said. Go by what your surgeon and your doctors. There's Sierra. Hi, girl. Hi. She's so cute. She's a Labradoodle. I'm watching her for the weekend, so it's cool. And then this is just an article that explains about obesity as a disease and saying how it is a disease. Oh, that's my dog. But yeah, it explains how obesity is a disease. So yeah. And then this explains activity for after surgery. And it just explains about how everything's going to change after my appetite's going to change, bowel movements will change, energy levels, sleep patterns. Everything's pretty much going to change, and then like not to lift anything over 5 to 10 pounds for at least 1 week and avoid strenuous activity. And pretty much your doctor lets you know when you can like go back to exercising again, and like, you know, like what kind of exercise, like if you can't like do too much. And then there's a paper that talks about medications. And then the next part is about support, and it's just paper that has like different things. And then miscellaneous is just pretty much nothing really. Just explains how the surgery is performed. Like mine would be a laparoscopic approach, so I would have 5 little incisions on my stomach. So yeah. And of course the risks that are involved in gastric bypass surgery and all that jazz. And then there's a paper that explains about behavior and psychological evaluation, and it's like a guideline. I think that's pretty much it. Everything else in here is just normal information stuff, so that's basically it. When it comes to my my bariatric stuff. All this other paper is just for my last weigh-ins. So yeah, that's it for the notebook. But yeah, so all it is for me is to get all the tests done that my insurance requires, which are highlighted, and the doctor has the paper forms for all that. And then get through your however many months. For me, it was 6 months. And then wait for approval, and then get scheduled to see the surgeon and get scheduled for surgery and go over what needs to happen. So that's pretty much it. February 1st is my last weigh-in, so I'm trying to do good. I haven't really, I mean, it's to be expected, but I'm surprised at least I didn't gain over Christmas break. That's what I was afraid of, but luckily I lost. But yeah, so I mean, for the past 6 months, I either gained a couple pounds, stayed the same, or lost a couple pounds. So, but hopefully they'll see that I'm struggling. It's not like, oh, I'm losing 5 pounds every month. Why can't I just do this on my own instead of having surgery? But they see that I'm struggling even though I'm doing everything correctly. So, yeah. So yeah, so now it's just the 5-year weight history thing, and basically, for that I had to call, or I went to my doctor and told them I needed like one of those like medical release forms, and I filled them out as well as the like hospitals and doctors I went to and their address and phone numbers. So I think they're the ones calling and dealing with all that. So hopefully they'll get that done. But if not, I guess I'll have to call, whatever. But at least they have those forms. So, yep. What else? Because a lot of this is like in West Virginia, so it makes it difficult when it's out of states. And it's been like a few years. But yeah, so, what else? So pretty much Luann, who is my insurance specialist, just told me that after my last weigh-in, which again, February 1st, I'll call her probably a day after. I think the day after. So February 2nd, I have to call her, let her know I had my weigh-in, and she'll make sure that I have everything that I need, and just go from there and wait for approval. And I hope to God I get approved. I'm gonna be so pissed if I went through all this hell and trouble only to get denied because of something like simple or stupid. And I'll be like, really? Because luckily my insurance did not require me to lose weight, but the surgeon just recommended that you at least maintain the weight and not gain too much. And luckily I had never gained that much. I think the most I gained was 2 pounds, but I ended up losing losing those 2 pounds that I gained. So it's no big deal. So hopefully I can get approved. And once that does happen, I'll make another video and let you guys know. And continue updating you guys throughout this whole journey. I'm sorry I was so quiet like during that, but all kinds of shit was happening and I just never could make the time to make another video, but now I will. And if you have any questions, feel free to let me know in the comments. And yeah, wish me luck. So yeah, bye guys.